All right, good morning, students. So we are going to go over and get right back into that instruments and materials PowerPoint for the 105-2 module for the surgical assisting. All right, so last time we were together, we kind of ended on talking about dental equipment for small and large animals. So moving forward today, we are going to look at bandaging tools. So our equipment that we use when we're bandaging, and I'm also going to show us a video after of bandaging a puppy. So certain tools that we're going to use when bandaging is going to be elasticon, roll gauze, whether that's brown or white gauze, and vet wrap. So kind of to get an example of a horse wrapped up here versus our doggo here. This is actually a full paw bandage. This bandage is going all the way over the paw. We don't have to do it unless there is an injury to the toes or to the paw. We can just leave it open-toed. That's fine if it's just an injury that's on the leg. And then our horses here, we're never going to be wrapping around the hoof unless it's like a special horseshoe bandage that usually has different wax and putty to hold it in place. That's a whole nother story. But we're just going to talk about basic bandages for our patients. So looking into the materials that we're going to use, the first one is elasticon. And if you've ever dealt with elasticon, it is super, super sticky. This bandage material is also really stretchy, which is great. So we're going to use this usually at the end of the bandaging. On the horse here, I would usually bandage both of the open ends here so that no moisture can get in and it keeps it nice and dry. For our dogs here, we could actually put a strip of elasticon on the palmar end here, right where their paw is, so that they have a little bit of extra grip. Because this is kind of braided, the bandage material, there's a good amount of grip in it, it's stretchy, and then it's also waterproof. So this stuff is great. However, because it's so sticky, it is really hard to remove it from our patients, and it can also really irritate their skin. So when we remove elasticon, we don't just want to rip it off of our patients. We actually have a few different bandage removal solutions that we can use. One of my favorite ones, aside from like something like Goo Gone, there is one on the market. It's totally coming away from me now. It's but it's just like Goo Gone. It's a spray. Oh, Detach-All. It's a spray that you'll spray onto the bandage, and then it easily just peels off the bandage. So none of that stickiness is going to stick to the skin or to the hair. It's not going to pull. It makes it really, really easy to remove, but it will make the hair greasy. So if we're reapplying the bandage, we're going to have to wash that off and dry before we reapply the bandage. So pros and cons to that, but elasticon is great. Again, it has that waterproof nature, so we'll use that a lot at the ending of the bandage. Now, this is an example of our roll gauze here. This is actually the white gauze, and it's a stretchy gauze. We can use this in place of roll cotton if we didn't need a really large bandage or a lot of security. Let's say if it was just for a wound versus a broken bone. It's really soft in nature, and again, it is stretchy. Versus we do have a brown gauze that we can also use after like a roll gauze or a cotton layer that has no stretch to it. So a few different gauze, and that's going to be more of the hospital's preference and also the owner's preference. You guys, if you ever work with horses and are bandaging horses, it's kind of rule of thumb that you're going to go with what the owner prefers. So we'll ask them what they prefer us to wrap the patients with, if there's a certain way they want us to wrap, versus small animal, we're just going to do it the way that kind of our hospitals instructed us to do. Horses are a little bit of a different ballgame, especially when you're dealing with trainers and several owners and such. So we kind of want to give them those options. But going back to that roll cotton, this roll gauze, this is really great because it does not have any adhesive on it. It's just a soft roll gauze that we can roll along the patient's leg or area that was wounded after we put the patch on. It has really great absorbency and breathability. So if the patient is still leaking or bleeding from that wound, it can soak that up and potentially help stop that bleeding. Then the final bandage material I want to touch on is vet wrap. So we'll use vet wrap in bandaging. It is self-adherent. So that means when you bandage it, it's going to stick to itself. So with these bandages back here, you can see that the vet wrap was just laid over on itself and it's going to stick to itself, no problem. We don't have to tape it down or anything like that. It's really sticky in nature. And we'll use this after we do all of the layers for our bandage. We'll do like a roll cotton or gauze first, then we'll go over with usually a brown gauze. We'll finish with the vet wrap, and then we can have elasticon on both ends. And again, there's a lot of different ways to do bandages. There's not just like one singular way. So what I'm going to do now is I want to show you guys a video of, this is a technician who's going to be bandaging a broken puppy's leg. Don't worry, you're not going to see any blood or gore or anything. It's more of just showing you the bandage technique. This puppy has had a bandage on prior. So she's just going to show you her method and what she does.
Okay, so we're going to be doing a bandage change on a dog that's got a broken leg. At the moment, I'm applying stirrups to the leg so that once we actually put our bandaging material on, it'll keep them from the bandage itself from sagging down or shifting too much on the leg itself. And my next, what I apply is soft roll. You want to do a good padding for this because it adds protection on the overall leg so that that support, and it helps to prevent the bandage itself from getting too tight. So normally I would go over the elbow, but this puppy seems to be doing really well with it just
So
over
she's
top
using
of the leg. It's
different type of roll cotton. So rather than doing that stretchy gauze, this is where that roll cotton comes in because it's definitely has more stability to it, and will help that broken leg stay as straight as possible. We can put a brace on them or a splint if it's needed. Sometimes it's not always needed though. And unfortunately, a lot of the broken limbs that you guys will see will be puppies or kittens because they're still developing and their bones are still rather soft. And they do tend to have a lot of energy, jump up and off and onto things, most commonly jumping off the couch when they're not supposed to be. So we do see it in these younger animals, but because they are younger, they're really resilient. They bounce back fairly quickly. And a lot of them don't even really know or what had happened. So again, this guy is doing all right here, getting that roll gauze, that cotton here, and then she'll finish up with her next few layers. And those stirrups that she placed on, those are great to use when you're doing a heavier bandage, especially if there is a broken leg. Don't always have to do them, but they are a great option.
Here, so we'll just keep going, get a good padding on it. So it helps just for the comfort. You shouldn't have to pull it really tight or anything like that, just so that you just want to layer it nice and gently on top of the actual bandage here. Once I get a good layer of that on,
Guys, what do you think would happen if we accidentally did the bandage too tight? Of course, our patients can't really tell us. What do you think would happen? If the owners called us on the phone, what do you think would happen if we did that bandage too tight? Yes, absolutely, Leslie. It's going to cut off the blood circulation and the blood flow. And with that, a lot of the time what we'll see is we'll see what's called fat paw. So when we cut off that blood circulation, when we do that bandage wrap too tight, there's actually going to be an accumulation of blood and fluid that will accumulate in the paw. especially if it's an open paw bandage. So their paw will start increasing in size because it's holding that fluid. And so we need to immediately cut the bandage off and redo it. There's not really going to be any salvaging of that bandage. So it's really important as we're bandaging to try to be aware of those pressures. You guys, it's going to be something that you'll learn over time. And when we practice bandaging, I usually have my students practice on each other. Like you'll wrap each other's forearms so that you can get an idea of what kind of pressure you should be placing. 9 times out of 10, people do it way too tight versus too loose. So it's acquired pressure, but yes, if we do it too tight, unfortunately, our puppy here can't be like, hey, that's a little tight on me. And we can cut off that blood flow.
Like to put my cling. This, you can be a little tighter with it, not too tight, but a little tighter because you have this protective layer on. This just holds it in place and adds that extra little bit of support to the bandage. So, and I'm going to do this. One more little layer. And then this is where I put my stirrups on. I just stop that, take my stirrup off, and turn it around, and I'll put it like this on the inside of the bandage so that it anchors that the bandage that I just put on so that it protects it. And then I'll just do another little roll over top, couple layer, another layer. Keeps it from shifting up and down the leg to a certain degree. This is a puppy, and I'm sure they're very active, but it'll help reduce the amount of slippage. And then I like to take my vet wrap. So we have a little female, so she gets pink, hot pink. And I always leave a few toes out so that you can feel in between. And when you know the bandage may have slipped or shifted or be putting undue pressure on, because if the toes aren't nice and warm, then you need to take them in and get the bandage removed and have it reapplied, because the toes should always be nice and warm. They shouldn't be swollen, and they should always be in the normal size. And then just nice and gently lay the vet wrap on. Kind of like to unroll it a little bit first and then lay it on, so that way you don't get it too tight. There. That. And then what I like to do is get some sticky roll.
And I apologize, you guys, they have a patient that they're putting under anesthesia. That's what you're hearing, all of the weird sounds and everything. That's just an anesthetic machine.
Put a little bit of sticky roll at the bottom of the bandage. And at the top, the bottom of the bandage, mostly it just adds a little bit of grip and just a little bit of support for the foot and the bandage from falling apart. Squawks, yeah. And then this one goes on the top, and I'll put it over top of the fur so that it anchors it onto the body. Just kind of put it on halfway.
So this is how I would use the elasticon, putting it on the top and the bottom.
Around. You should always apply a bandage to a dry limb or body part, just so that it doesn't, anything moisture in there can cause a lot of dermatitis, infections, skin infections. So this leg was nice and dry. The owners have been doing a good job at keeping it nice and dry. And that says a lot for a puppy. And that's the bandage.
Oh, all right. I was just going right into my next video. We'll actually watch that in a moment. So getting back into our lecture here. So that was our bandage materials. So now I'm going to go into some certain restraint tools that we use during the physical exam. And I'm going to show you guys a video of restraining fractious cats and tools that we can use. Restraining dogs, just basic restraints and how to use, as well as I'm going to get into using twitches on horses, which is a restraint tool that we use commonly with horses. And I feel like there's a large misconception. People think it's almost on the cruelty side, but in reality, if you're using it appropriately and properly, it's not doing that at all. So I do want to show a video so that you guys can actually see what I'm talking about with these different restraints, put it in more of a visual aspect. All right, so one of the first restraint tools that we can use in a clinic, this is called a cat bag. And this is a device used to help veterinary staff restrain kitty cats, especially cats that are not super happy. So what we can do is we're going to put them in this cat bag and we're going to zip them up. Now, some cat bags will have to where they have the zippers in the front to where we can actually pull their front legs through. And others have it on the back as well. They should have rear and front zippers so that we can pull blood from either of the front or the back legs, as well as this one doesn't have it, but this one does have a mesh, which can allow water in if you're trying to bathe or do an injection, something like that, where you might need access. Now, personally, as somebody who has worked in an all cats clinic, and I'm definitely a cat lady, I will say that I hate these cat bags. I hate them. I don't think that they work. I think that they stress cats out more than they help them. There is so much better ways to restrain them. For example, using chemical restraint, I would much rather see the patients have a little bit of small sedation or anti-anxiety drugs on board and using pheromone therapy rather than shoving them into a tight bag where they can't get out of. Cats are notorious for being fight animals. So they are going to be, instead of trying to run away from you, they're going to try to fight you. And cats will win every time. They are so much quicker than us. And it's so not worth the energy and effort and also the stress on these patients to be shoving them in these bags. When I was working in cat specialty, there's a doctor right now who's patenting a new cat bag. So just be patient. It might be on the market within a few years. I'm really crossing my fingers of a different type of a bag that can help us get them out of the carrier and successfully sedated if that's what we need to do. With these cat bags, their head and face is still exposed. So they can still see everything. Cats like to hide. They'd much rather be in a towel or a pillowcase where they can hide and be away from all of the action than having their face completely visible to everything that's going on. So again, that is my opinion. I don't like them, but a lot of people do like them and use them, and that's fine. Just my personal opinion after being in specialty. And Michelle, that is awesome. If you ever need help with picking out an externship site, you can let me know. I do know that we have cat specialty clinics that we can send you to for your externship. There's actually quite a few in Orange County, just in general. I had looked that up. So there's quite a few just in the area. All right, so I want to show you a video, you guys, of this is another one of my favorite channels, at Dove. Megan, she's a great technician. She's going to show what we should do with these. Oh, that's awesome. I know that they have those cat clinics popping up everywhere, which is amazing. So she's going to kind of show her methods on how she would get this kitty cat out of the carrier. She's going to be using towel restraints. I believe they put a cat mask on this patient, which is just like a muzzle for our cats. And some cats react really well to this because it does give them a dark enclosed space. Other cats really don't like it. So we kind of have to feel out our patients and see what they're comfortable with. And this is a 10-minute video, but don't worry, I'm not going to have you guys watch it for the entire time. I really just want you guys to see the beginning of it and the end. And they do end up sedating this cat. And you guys, a lot of the time, that's what we'll end up doing. We'll either give the owners some like mild sedation, anti-anxiety drugs to go home, a pill that they can give the patient about an hour to 2 hours before the vet visit, and it'll just kind of calm their nerves. And usually we can do everything that we need to do at that point. Some cats we're going to have to sedate them fully every time. And that's okay. I'm sure there's that goes the same for all different types of animals. And I know it does. But they will be sedating this guy more because of the diagnostics that they need to do. Most of the time we can get simple exams done even on these fractious patients, but if we're trying to stretch them for x-rays or get a urine sample or something like that, it's a lot better just to give them the sedation drugs, and we can reverse those rather quickly for these patients.
Hi, I'm Megan. Today we're going to deal with an angry cat. This is Max, and he's been vomiting and losing weight. And so he's here today so we can examine him and draw some blood. He has been fired from other veterinary hospitals, and so we know that.
And guys, when they mean fired, that means that they told the client they cannot bring this patient back. He is too much to handle. And if you are working at a general practice clinic that sees both dogs and cats, a big reason why I kind of am talking a lot about cat specialty is cats do a lot better when they're not hearing barking dogs and all of that auditory stimuli, especially if the cats aren't around dogs to begin with. My cat, for example, she's an only cat. She is the princess, and she stresses out hearing dogs barking, the scratching. She'd be bouncing off the walls. But I took her at my cat specialty clinic where I was working, nice, quiet, gentle. It was a totally different experience for her, and she was so much better behaved. So sometimes it's really just that stimuli, it's too much, which is why we do recommend taking them to specialty.
That he has a history of being angry. He's in here kind of growling at us and preparing for the worst. So we are getting
those plastic tools that they have down there. That's the cat muzzle, and you'll see she'll put it on this kitty cat in just a moment.
Set up. Since I know he's angry, we're just going to assume that we're going to need some pretty heavy restraint on him. So I've got a cat muzzle out. In my opinion, this is the best invention for cat restraint ever. It's really hard plastic, kind of patenty, and it goes over there. His face is going to go in here, and we tighten it down behind his ears, but he can still open his mouth. He can scream, he can hiss, he can breathe unobstructed, which I think is the problem with other cat muzzles. When they can't open their mouth, they feel like they can't breathe. That becomes a real problem. So goal number one is going to be to try and get this on his face. I also have a big blanket. This is not a cat that a towel is going to help with. So we've got a big, thick blanket. Sarah is going to help me. So there's going to be two of us working on him. And the goal is just going to be to be as efficient as possible. I have everything ready. I have a thermometer. I have a scale, everything I'm going to need to draw blood work. We don't want to anger him and then have to shuffle around and find our supplies. Also kind of on board with the doctor. So she knows exactly the order that we're going to do things. She's got a plan in her head. We don't want to get this angry cat out, do a bunch of stuff, put him back, and then have the doctor come back 5 minutes later. Oh, by the way, do you mind doing this? So just make sure there's a lot of communication when you have an angry animal so that you can get everything done, get him put away and on his way. There's a carrier that opens from the top, but I am going to just take the carrier apart. This is kind of a small hole for us to get our hands in and drag him out of. So I'd rather just, we'll kind of pop all these. And then when we're ready, we'll take the top off, get the blanket on him, and pull him out. I'm not a big fan of dumping cats out the front, just in case he bolts and we lose him. That's not a good situation. You don't ever want to have to pull a cat out from under cupboards or, under a shelf or under a cage or anything like that. Certainly escaping out the front door, running into some dogs, all bad news. So we want to be as controlled as possible. I don't know, something's up, buddy. Okay. Right. Wants to go hide in there. Okay.
You'll notice that she took the top off of the carrier. You will never, ever, ever want to open the side door and stick your hand into a carrier, ever. That is exactly how you're going to get injured. If you can, open it from the top, take the entire top off. It's going to take you 2 extra minutes, but that's going to be worth it. Yep, and you guys will see it all the time. Kitty cats, they'll be, the sweetest, most angel, perfect babies when they're home, but they get stressed and their fight or flight, their fight mechanism is going to kick in. So it's not that they're bad cats, you guys, they're just in a stressful environment and they're protecting themselves. So, not to get upset with these cats, more try to understand that this behavior is normal.
So,
and he's yelling right now. He's trying to be intimidating. So it's not that they're hurting him or doing anything. You'll hear cats that scream or yell like that, and it's to intimidate the people that are around him. Again, that's the fight mechanism.
I am just going to pay attention to where his head is. So I've got my hand just kind of around his neck to control his head. This cat, it's never going to do us any good to scruff him. I think a scruff is a really good tool when you need to kind of immobilize a cat, if he's struggling a little bit when you're trying to get blood. But when a cat is really angry and you scruff them and you pull tighter and tighter and they struggle more and more, they actually can't breathe anymore. It puts enough pressure on their trachea. So when I have a really angry cat, I don't scruff at all. I'm just gonna kind of pin his head down. So I know his head is right here. Just pin his neck down so that he can turn and bite through the blanket if he wants to, but just control that head. We'll kind of get his feet under the blanket as we need to, and then just go from there. So a lot of angry cat restraint is just holding them down to the table, which Sarah is gonna do. So now I'm gonna turn him so his head is facing towards me, and we're gonna get the muzzle on. There we go. Okay. So just kind of feed his head in there. Make sure the straps get behind his ears. And just cinch it down. It's not impossible for him to get this muzzle off. If he gets his back legs up there, he can certainly flip it off over his head. But now I know that his teeth are covered and he still has a lot of room to breathe in there. He's still growling. Oftentimes just getting things dark is going to help him. He's not going to, be able to see us moving around and, anticipate movements toward him. So we'll just kind of leave him in the dark, and next we'll get a weight. Relax.
So they're going to pick him up and put him on the scale. With these angry kitty cats, we actually like to weigh them in the towel and blanket, and then we'll put them away, and then we can just take the towel and or blanket, reweigh that and just subtract it from the overall weight. We can also do that in the carrier. We can weigh them in the carrier. Then once we take them out, we'll just weigh the carrier and subtract that weight. So we don't have to worry about getting this cat onto the scale with nothing on him, because that's really impractical. It's just not going to happen. So they're going to put him on the scale, and doctor's going to come over, going to do their exam. And I just want to show you here, they're going to actually be able to get some blood sample on him. They do end up sedating him. I believe it's because they need a urine sample, and that happens. It's usually really hard to get that cystocentesis done with angry kitties when they're wide awake. So
find him, retrieve him, and get him back, but nobody wants to go to the hospital. So I'm going to draw blood from this cat. I don't anticipate him behaving very well, so I'm going to use a butterfly catheter. This is a 23 gauge butterfly catheter. The reason that I like these is that it gives him the opportunity to struggle a little bit, and I'm not going to lacerate his vein. If I've got this syringe on it and he moves around, it's pretty easy to cause some trauma there.
And as you can see, they had 3 people on one cat. That's completely normal, especially if they are, more fractious. You never just want to have one person. You should always have 2 or more.
Okay.
So she's going to get her sample. And they end up putting this guy away in his kennel, and then they actually do have to get him back out. So I want to show you guys what it's like to get an aggressive kitty cat out of the kennel.
There.
And just real quick, you can see it's going to say caution. We will clearly label it on their cage cards to let people know this is a caution cat.
Hands on either side of his neck, and then just scoop him up and go from there. Okay. All right.
Guys, and he's screaming because he's angry. He's not screaming because that cat is being, he's not painful. It's not that they're, slamming him down. He's just trying to be intimidating. They're being very gentle. They're using nice big blankets, and you're going to see she's going to pull him over and they're going to give him some drugs so that he can get a little sleepy. But they sound, it's very loud. It's very intimidating. So she's giving the sedation drug now.
Okay. And now we're just going to kind of wait until he calms down enough. So we've done our oral exam, and
so they were actually trying to look in his mouth. I guess he had some tooth problems. So giving that sedation, relaxing them down, there would have been no way they could have looked in that cat's mouth with him being that angry. No way. And it's not worth it. People could have gotten injured. It's so much easier to just do a light sedation injection, and then we can wake him back up right after. And remember, that's not anesthesia, that's a sedation. So it's kind of the step below. Yeah, absolutely. People tend to it kind of depends on who you are. Some people find cats to be scarier. Some people find dogs to, be a little bit more intimidating. And that's honestly just going to be you and how you feel. I actually really like spicy kitties like this. I find it kind of like a challenge. And, of that, okay, well, how can I make this work? And, I'm more of like, oh, why are you so mad? Rather than being like, oh my gosh, this cat's really mad. They can sense how you feel. They absolutely can feel your emotions, your vibes, everything that you're sending off. And if you are scared out of your mind or assuming that this cat is going to hurt you, 9 times out of 10, they will. But if you're confident going in, if you look at it from a different perspective, you will absolutely see that outcome be better. And again, I am definitely a cat person. There's going to be people out there that are more of a dog people. It's not that I don't like dogs, but I'd much rather deal with a spicy cat than an aggressive dog. So again, just preference. Nothing wrong with that. All right, so that was our mad cat video. So I'm going to show you guys some restraint tools for dogs. We'll go over another, just a basic restraint video with dogs, and then we'll keep continuing on. Okay, so with our dogs, we will use sometimes, this is more in shelter medicine, we can use what's called a catch pole, or it's also known as a dog snare. So we can use this tool. It's got handles up here. This is what we'll hold on to. And then it's got a little noose at the end. So we can release this noose to where it gets a lot looser. We can then run that over the patient's head and then tighten it. It's like a slip leash, but attached to a pole. And that way the patient cannot come and charge you. They can't come at you. You're going to have that pole in between you. And again, it's really more commonly used in shelter medicine, especially, trying to rescue these dogs that have been abused, that are already just so scared. They're in that attack mode, that fight mode. Rarely do we use these in a veterinary hospital because, again, it's kind of just a lot easier to sedate them rather than fight with them. But if you're in a rescue situation, you definitely might be needing to use a catch pole. And we could also use this, not even if they're aggressive, but if they're infectious. So if we need to make sure that when we're walking this dog, let's say that they have parvo, you guys, we don't want to get parvo all over ourselves. They're going to be in an isolation ward, but we need to make sure that they're not touching everybody and having free rein like they would on just a normal leash. So a catch pole can give that distance and also make sure that they're not moving around too much if we have to transport infectious dogs. This is a basket muzzle. This is more common as like a day-to-day use for owners that have dogs that might be dog aggressive. Like, let's say they're going on walks and they, want to make sure that, nothing is going to potentially happen. These basket muzzles, the dogs can still pant, bark, open their mouths with the basket muzzle on. They can even still drink water through it because there's holes right around. It looks like a big old basket on their face. We also do use it in vet med sometimes, because with dogs, especially if they do have aggressive tendencies, sometimes when we put on a nylon muzzle like this, they can't open their mouth, they can't bark, and sometimes that's going to make them 10 times angrier. They're going to react really poorly to nylon muzzles. That's not all dogs, but if they do, that's when a basket muzzle is going to come in handy. We can definitely use that as a better muzzle tool. But nylon muzzles, these are standard. We'll use these every single day for dogs that might be aggressive or possibly be aggressive. We want to read their body language. It's really huge. You know, when they come into the hospital, are they tucking their tail? Are they cowering? When a dog looks scared, they are on the verge of turning that around and becoming aggressive. So we can't just, you know, oh, he's just scared. Well, 9 times out of 10, the dog's going to bite out of fear, you guys. They don't bite because they're mad and aggressive like cats might do. These dogs will actually bite because they're so scared and you're cornering them. They have no escape and they'll bite you out of fear. So muzzles can be a great tool. We always kind of a saying in the field is like we use them to keep them honest. We don't want you know, to have them have a bite record. Once an animal has an established bite record, that's there forever. And so we want to prevent that from happening as much as possible. Yeah, so yeah, and that's going to be preference of the hospital, baskets versus nylon. And some dogs do completely fine with the nylon muzzle. They have no problem. But we're going to kind of assess our patients as we go and use what need fit. I will say that I like nylon muzzles better on smaller dogs because the basket muzzles that they make for tiny dogs sometimes don't fit the face very well. Think of like how you have so many different shapes of the head versus like a Chihuahua from a Shih Tzu, you know, and all of those smaller dog breeds. So can kind of be here or there. Again, it's going to be preference and whatever that animal is going to be most comfortable with. So before I get into talking about horse twitches, I'm going to show you guys just a basic video of some dog restraints. They're going to just, well, be going through here. Let me see. I don't want you guys watching it forever, but I might fast forward a few little parts. I know that you guys are seniors and you guys have done these restraints, but it's always good to get a different perspective.
In this section, we'll discuss good lifting.
And I really want to talk about this good lifting, especially when you have large dogs, you guys. It's so important. Guys, what is the maximum weight you should be lifting by yourself? If you have a large dog, when should you grab another person? That's correct, Michelle. If your dog is 40 pounds and under, you can lift by yourself. But if the dog is over 40 pounds, you should absolutely be grabbing 2 people. If you lift a dog that's 45 pounds and you get injured while you're lifting that dog, you technically are violating your workplace safeties and rules, and you might not be covered by workers' comp. So make sure that you grab that second person, even if you're crazy busy. It doesn't matter. It's not worth getting injured over and not being covered.
Mechanics and techniques to prevent being bitten while lifting and handling a dog. Picking up a dog to move it from one location to another should be your last choice. First,
so we always use these slip leashes whenever we're grabbing dogs from in and out of the kennel. We never want to use their own collar and leashes because they could slip out of them.
Try getting it to walk on a lead or transport it in a carrier or cart. However, there are many cases where lifting various sized dogs onto treatment tables are necessary. Let's discuss restraint lifting first. Whenever approaching a dog on the ground, it's always safest if they are properly leashed. One of the first rules of thumb to remember is that you always want to control the head. One way this is accomplished is with a leash, especially if it is of the choker variety or one that tightens as the leash is pulled. There is a psychological advantage in that the dog is more likely to assume a submissive role. However, be careful to never choke a dog when leashing. There is a difference between firm restraint and choking when using a leash. Once the dog is leashed, you should first attempt to gain the dog's trust before attempting to lift him. First, get down on.
So I was just going to talk about, like, you know, getting down on their level. We should always be trying to acquaint ourselves with these animals and give them the chance. Again, dogs tend to be just really, really scared. So we do want to try to get on the dog's level. When we're standing above them, looking down on them, it can be really intimidating. You do want to try to offer your hand for the dog to smell, but you never want to offer fingers. Fingers are food. So you want to have a closed fist and offer them to smell your fist. We also want to talk to our patients in quiet, friendly tones. You guys, we talk to our patients in vet med like they're little babies. Oh, they're the sweetest little best dog in the world. You're so good. We want them to feel as comfortable as possible. So we're going to baby talk them. That is so normal and standard in the field. And then we're going to gently want to try to pet them, maybe offer them treats. And some dogs will just muzzle them because even with trying to gain that dog's acquaintance and trust, they're still a little bit sketchy. There's some signs that they still might bite.
Safely handle it. Once you have established a level of trust with the dog, you can attempt to pick them up. In cases where you have not gained the dog's trust or the dog shows
So this is actually a leather muzzle, kind of more old-fashioned, but they work similar to nylon.
continual aggression, you should consider using a muzzle and having an assistant help you lift and restrain the dog. If this is the case for a very large dog, consider conducting the treatment or exam on the floor instead of a treatment table. When lifting a dog, you will want to pick it up with confidence, as it will often squirm if it fears being dropped. With a small dog, you will want to control the head with one hand while wrapping the other under the dog's chest. Notice how the handler is using the leash in this situation to keep a small amount of tension on the head and neck. This helps discourage a quick turn and possible bite. Once off the ground, dogs are generally more trusting, allowing you to sometimes relax your control of the head and neck.
Yep. So some dogs do a lot better once they're placed up on the table versus your large dogs. It's really standard for us to actually crouch down and do exams on the floor. Sometimes they're just more comfortable there. We definitely will look at our patient and their preference and try to do what's best for them. We never just want to do it, this one way because we always do it this one way. No, every patient's going to be different. We should be evaluating them as such. So they're just showing you more methods with lifting and stuff. Again, always grab two people. If you are over 40 pounds for that patient, one person should be at the front end, another person should be at the hind end. All right. Now, the next restraint tool I want to talk about is a twitch. So unfortunately, twitches have kind of gotten a bad rep, especially if you're not a horse person and you've never seen one before. They can look really kind of brutal, to be honest. So twitching is a really common restraint method that we use in horses and livestock as well. So we can use it on the lip. We can also place it onto the ear. It's a lot better to do it on the lip though. When we put it on the lip, it actually will help release endorphins throughout the body for this horse, which will then help calm the horse down. So it's not like it's causing them a whole lot of pain. It might be a little pinchy. It's actually going to help them redirect their attention to the twitch and what's going on there versus, their leg if there was an injury or something going on. With horses, we can't just hold on to them and tell them to stay. You guys, these patients are going to be anywhere between 800 to 2,000 pounds. We can't hold that. So we have to use certain tools to help us when trying to work with these horses. So this is a chain twitch. It does have a metal chain at the end and then this wooden handle. I'm not a big fan of the chain ones. They do make ones that are a lot more comfortable for the horse and not going to pinch them as much, which is going to get into this humane twitch. So this one is just kind of got metal barring. The lip is going to go right in between that and we can hold it down. And then there's a string that we can go across. They also make like the chain design with like a rope instead so that it's not a chain that could be pinching on that lip. Now we can also do what's called a shoulder twitch. And it's the same kind of mentality and, actions of kind of pinching an area on the animal. It's actually going to be the shoulder. You can actually grab and kind of twist to pinch the shoulder. The horse will kind of bend towards the shoulder. They're going to focus on what's going on with the shoulder rather than whatever else is going on. If we're trying to bandage their legs or place an IV catheter or do something else and the patient is just all over the place, we are definitely going to want to use a twitch instead. If we have to sedate horses, you guys, it's so different than if we're sedating a dog or a cat. It's way more dangerous. to sedate horses. So we really try to avoid that as much as possible. Yes, and it's super similar, Michelle, like as if to scruffing a cat. A lot of cats react really well to a scruff because it does release endorphins, which will naturally calm them down. For the cats, the scruffing, the mom used to pick them up by the scruff and put them on the teat to nurse. So it's kind of like a recollection of when they were younger. And the twitching, it just does have a similar effect as that. So I want to show you guys a video real quick. Again, I'm all about the videos today because I want to show you how we use these twitches. This horse is standing in stocks. So because we can't hold our horses in place, when we do general exam on horses, we usually put them in stocks. It's a lot easier. It keeps the horse in place. It keeps us a little bit safer when we are doing that examination on the horses.
In this video, we want to introduce methods of light restraint. These are going to be useful if you need to medicate eyes, give intravenous or intramuscular injections to a slightly fractious horse, or just to hold a horse still while you bandage, clean a wound, and do any light examination. We're going to start with what we call a hide twitch. And what that is go just in front of the shoulder and you catch some skin and roll that in your fist.
So that's that shoulder twitching I was talking about. Now, I know that that might look a little bit abrasive, but it's actually really, really effective. And it's not really that painful to that horse. There's so much extra skin here. Think about scruffing your cat. The scruff isn't painful. Neither is this.
If you notice, this horse draws to that side, that
Yep.
gets his attention, and that makes it useful to do anything light that's non-painful, or to help you put another twitch on a horse that you cannot get a twitch on as he's throwing his head. We'll watch again when she takes her hide twitch, how that gets his attention and draws. This does not hurt. You can do this repeatedly.
So you can see if that hurt the horse, you guys, they would have pinned their ears and immediately go to bite you. So this isn't hurting this horse. It's more of redirecting their attention.
There is no damage whatsoever to the skin, but it does get their attention. We're going to move on to your nose twitches.
So this
First-
horse is in a stock system. So we have them tied in at the front and at the back, so they can't move forward or backwards, but they're not like super tight in the stocks. Really great for when we're doing the examinations on horses.
First one we're going to start with, because it's most useful to somebody that's working alone, is going to be the humane twitch. There are several forms of this, but they are not a chain or a rope. Basically, they are applied. Pinch the nose, not in the widest portion of the twitch. There's a small rope that you can wrap around the handle. Tie that back in.
And you can
To your
even clip
halter.
it to the halter.
And now this horse, if properly tied or otherwise restrained, has a twitch placed. You can now go to the rear of the horse, perform whatever task you need to, and he is properly twitched. You can take that off. It's important to realize you don't leave a twitch on very long. They lose effectiveness the longer that they're on. We're now going to demonstrate a rope twitch. And I want to talk about the proper hand technique. If you'll pause a moment.
So instead of having that chain twitch, they use one with a rope. This is much more preferred. I would much rather use a rope twitch.
If you see the pinky finger is outside of the rope, the other fingers and thumb are inside and ready to take a side-to-side hold on the distal portion of that nose. And now you can roll your rope or chain off of your fingers. If you notice, the twist is kept in a straight line. That is the most effective knot that you can have in a rope or chain twitch, because a very little pressure can increase your pressure on your nose drastically. The other thing that's important to do is stabilize that head. You don't want a head slinging side to side with a twitch. So one hand is used to stabilize the head. The other hand is used to keep or apply your pressure on your twitch. And that can be changed as needed whenever you see how they respond to what you're doing. We'll take that off and show you again the same procedure with the.
So you guys get the gist of it. Using these twitches to help when we are doing these restraints for these horses. They also will put it up on the ear. So I'll show you kind of what it's like if they want to put it on the ear instead. Some horses really don't like the lip. They'd rather have an ear twitch, but you have to be super careful with the ear that you're not overdoing your pressure, because you absolutely, as he's going to say here, you can cause damage to the ear. So more commonly we'll use the lip, sometimes we'll use the ear.
You want to grab the ear laid back against the head and twist to the right where that ear is laid backwards. You do not have to put too much pressure here. It does get their attention. And as long as you have that ear laid back and you notice there's not a serious crease in that ear, it will not hurt the cartilage of the ear. The ear is folded in on itself, just as if you'd squeeze it together. There's no problems there if you do not over apply that. You use the ear twitch really on.
And this horse is like, oh goodness, doing these videos again. They probably use, this is probably one of the horses that lives at that hospital. So anyways, just an example kind of showing you guys how to use those twitches. Super important with our equine patients. Let me see here. Okay. So we'll do a few more slides and then we will go on a break. I want to talk about cattle chutes, and I'm going to show you a video on cattle chutes. So this is what's called a head gate. So we will use this when we are performing certain procedures on our cattle, whether that's dairy or beef cattle. So we will walk the cows. It's usually they'll be like almost like in an assembly line walking through. We'll push one cow in at a time, get their head through the chute and close it. So don't worry, they still have adequate room for their neck. They can breathe and move their head just fine. It just keeps them from walking through that chute. And we'll do this when we're checking them. We can also open up this bottom part of the chute and do work on their feet. If there's any chipping or problems with their hooves, we can vaccinate them in the chute, pretty much do a full physical exam in these chutes. Now, there's also another chute. This is called a squeeze chute. So you can see there, we're talking about the head gate here. So the opening and closing of the head gate, then versus looking at the actual chute. And this chute, if controlled properly, we can actually squeeze the bottom of their legs together to help further restrain these cattle, different types. I want to show you guys a video of a hydraulic chute. These are kind of newer on the market, but you'll see them a lot in bovine medicine. They're super useful. So again, if you're not working on cows, you probably won't see one. I'm going to fast forward until we can get to where it is. So this is a cattle farmer. He's going to be checking some of his cows here, and they're going to put them into a chute. And then this chute is hydraulic. So it's going to start moving. They can pick it up, turn it to its side. It's quite interesting.
I thought was the best one. All right, well, let's get her turned over.
So they have the cow in the chute. The head is through that head chute, the head gate at the front. And now they're going to start moving this chute around. They're going to look at the hoof. I think there was an injury with the hoof.
Be safe than sorry. Oh, yes.
We've got our big controls up here.
When
And
we
it's
do
gonna
these
start
lambs
turning the
exams,
cow over.
We're getting these animals in that squeeze hydraulic chute, basically presenting the feet to us to work on rather than pulling them back, injuring the animal, injuring you, safer for everyone.
It can be so much easier just turning them on their side and then not having to lift up that hoof. These are quite incredible pieces of machinery.
We had an old hoof wall crack. 4 weeks ago, we put these blocks on, take the pressure off of this claw and relieve the lameness. And we cleaned this out and debrided that real good with some tools. 4 weeks ago, this crack was really, really, really badly infected. All right, well, let me check with this hoof tester here and see if we relieve, if she's got any active pathology. I'm putting pretty good pressure here on this lesion. She's no pain issues there. When we do these lameness exams, we're doing a good exam, and oftentimes we clean these cracks out. And then let's grind this down, just smooth this up a little here. Very safe, very easy on the animal, very easy on the veterinarian as well. We're starting to get some new growth right through here.
Yeah,
Yeah, that's good, healthy tissue right there.
yeah. She'd be good as brand new in 8 more months.
Yep. Go ahead, guys. We'll put our concoction on there.
I like to take care of my animals just like I would my own feed or my kids' feed or my dog's feed. My cows do the same thing.
All right, so
No
I think
problem.
she's ready to go.
Gonna lower her back down and she's good to go.
This will be the test when she walks out. Oh yeah, she's looking good.
So this is completely controlled by those hydraulic controls, these chutes. So they're kind of becoming more common nowadays. And again, it's because they were able to literally take this cow up off the ground, twist it onto its side, move it onto its side to where they could work on that hoof. That cow was just laying there relaxing, having no problem. Yeah, so for a hoof like that, it's going to take 8 months for that top of that crack to grow all the way out. Hooves are very slow growing, especially on cattle. Horses, we might see that grow out within like 6 months, but that was a pretty good crack. So 8 months is definitely sufficient for the time needed to grow it out completely. Okay, and then I do want to touch on, we do use a similar tool for hogs. So for the for the pigs or hogs or swine, we can use what's called a hog snare. So we can use this, same kind of thing, little noose down here. We'll put that over their head and tighten it, and then we can walk them into the trailer or the other barns, whatever we need to do for transport, similar to that catch pole in dogs. And we're going to take a little break before we get into this reproductive tract instruments. So we'll go over, this is more for our large animals. So we'll talk about that when we get back.